Well, right now, the most important thing is that we get the transmission of the Ebola virus under control. So currently, there are about 7,000 cases across the three countries, and for every one person that is infected, they're infecting almost two more. So we've got to change that, and that means getting more treatment centers, more beds available for patients, and getting them out of their homes. The other thing that is really important, and what I saw when I was in Liberia, was the impact on children. And there are now almost 4,000 orphans whose parents have died of Ebola. We need to get them the help and support they need and get them reunited with their families. So those are the two things that I think are most important, and two things that Save the Children is working on. Well, I'm really concerned about our staff that are there in Liberia. We have about 150 people on the ground, and I'm certainly very concerned about them. We are taking lots of precautions. Everywhere you go, you're washing your hands with chlorinated water. You're stepping in chlorine baths, so if there's a virus on your feet or your hands, you're killing it. You are not touching anyone, hugging anyone, shaking hands with people. That's definitely not going on. And obviously, if you're in direct contact with an active Ebola case, you're wearing that full protective gear. So we're making sure that we're trying everything we can to keep our staff safe. But I think Save the Children and organizations like ours really do have to be there on the ground to help. I think here in the United States, we are very, very safe from an outbreak of Ebola. The healthcare system here and the ability to isolate people and to treat Ebola is far, far better, certainly, than anything in Liberia or Guinea or Sierra Leone. We still have to be vigilant. I think we need to screen people who are coming in from West Africa. We need to make sure they know what the symptoms of Ebola are and make sure that they seek medical care as soon as those symptoms might become apparent. But I don't think here in the United States we have to worry about an Ebola outbreak. I think we're going to have cases here, as we probably will in many countries. But the best way to keep people safe here is actually to stop the epidemic in West Africa. Well, there certainly is a huge amount of work now. The U.S. government is putting lots of support into Liberia. They are building Ebola treatment units, as are organizations like Save the Children. There is a huge amount of awareness building going on. There's, the radio is playing messages 24 hours a day to people to educate them about what this disease looks like, what they have to do to keep themselves safe, how they seek treatment. So everyone is working very, very hard in Liberia to control this epidemic. But again, I think the biggest need right now is to get more treatment facilities up and running there. Well, I think, we can all help support the efforts. Certainly, we're asking Americans to support Save the Children and our efforts there, both on the treatment and care units that we're building and also for orphan children. And people can go to the website, savethechildren.org, find out more. One of the things we're raising money for now is these survivor kits, which are given to orphan children, food, household items, because everything in their houses really usually is burned in the case where you have a family member who's got the disease. So food, household items, hygiene items, at least enough to help these children right now. Thank you.